Good morning, everyone. Welcome to day 16 of Acharya Red Connect 2025, a premier online webinar series organized by Department of MIT, Acharya Institute of Allied Health Sciences in association with Indian College of Radiological Technology. I am Rizwan, your host for today. It is my great pleasure to introduce our next speaker for today's session. We are incredibly fortunate to have with us Dr. Abhimanyu Pradhan, Associate Professor, Department of Medical Imaging Technology at Manipal College of Health Professions, Manipal Academy of Higher Education, Karnataka. Sir brings him over 9 years of teaching experience at both the undergraduate and postgraduate levels. In addition to his teaching role, Sir has also served as the Radiation Safety Officer at Dr. TMA Pai Hospital, Udupi. Sir is also an active member of several prestigious committees. He is a core committee member of QMR and IQAC at MCHP, where he contributes to improving the quality of education and research at the institution. With more than 9 publications to his name and a wealth of knowledge gained through attending multiple national and international conferences, Sir is a recognized expert in his field. His experience and insights will undoubtedly provide us with valuable perspectives today. Please join me in welcoming Dr. Abhimanyu Pradhan. Over to you, sir.
Thank you, Murul. Am I audible?
Yes, sir.
Okay, so I'll be sharing the screen. Thank you for the introduction. So is my screen visible?
Yes, sir.
Okay. So today we are going to see about the ethical and legal aspect of radiation use. So before we begin the presentation, let's have a small brainstorming kind of thing. So did you know that the single full body CT scan can expose a patient to a same amount of radiation of 400 chest X-rays? And even more shocking, studies have estimated that up to 2% of all the cancers in the US may be linked to radiation from medical imaging. Yet, every year, millions of unnecessary scans are produced worldwide. Now imagine a young woman who goes to a hospital after a minor car accident. She is feeling fine, but doctor orders for a precautionary CT scan. Years later, she is diagnosed with a thyroid cancer. Now, could that single scan have played a role? So, as a medical professional, we must ask ourselves, are we protecting our patient or are we exposing them to hidden risks? So, with this small introduction, in today's class or today's webinar, we are going to explore about the ethical and legal responsibilities of radiation exposure in medical imaging and how can we balance the benefit of technology with the duty to do no harm. So as an ethical principle to do no harm and what are the legal aspect of radiation use is what will be the today's agenda. So this is the topic. In today's presentation, we are going to see at the ethical and legal considerations surrounding radiation exposure in medical imaging and emphasizes the importance of patient safety, the necessity of imaging procedure, and adherence to the regulatory standards. So let's dive in. Let's talk about the importance of medical imaging since its discovery in the year 1895. It has revolutionized the medical industry. From a simple hand image to a cross-sectional imaging, everything has been advanced in terms of medical imaging, in terms of diagnosis. So that is the importance of medical imaging. Okay, it plays a very vital role in accurately diagnosing and treating various health conditions. When it comes to medical imaging, I'm not just talking about the X-ray equipment, but I'm talking about all the equipment, whether it be the baseline imaging modality, which is the ultrasound, to the highest imaging modality, which is the MRI. Okay, but now our concern over here is only for the modalities which is using ionizing radiation, which is about X-ray, CT, and fluoroscopy. Okay, and we need to understand what are the potential health risks when it comes to the modality which uses ionizing radiation. So what is the risk involved? Obviously, the risk is immediate risk is cancer. Okay, I mean, which is your somatic effect. In your future, you might be exposed to this amount of radiation, and you might be, you know, exposed to, or you might be developing cancer because of the exposure to radiation and other health related issues. So that's why we need a careful management of radiation. Okay, as there are studies which has shown that the amount of radiation as low as 10 millisievert. Now 10 millisievert exposure is equivalent to doing a whole body CT scan.
Excuse me, sir.
Yes.
Sorry to interrupt. Would you please put the presentation in slideshow mode?
What's happening? It's not happening. Slideshow.
No, sir.
Now,
No, sir.
no, I've tried to put. It's in the slideshow only. Wait. Now, is it slideshow?
Now it's okay, sir.
Now it's fine.
Yes, yes.
Okay. Okay. So when I was talking about the potential risk of ionizing radiation, as we all know, we work in the field of radiation. So we all know that eventually, if it is not managed properly, there is a probability. I'm not talking about 100% everyone gets cancer, but there is a probability of cancer, okay, and other health related issues. So we don't talk about acute radiation syndrome over here because our amount of radiation does not exceed that threshold. Okay, so we need to be careful about the non-threshold dose. So we need to be equally understand the ethical consideration when it comes to radiation protection. So ethical principle in medical imaging prioritize patient safety, informed consent, and transparency in decision making. So that is what our ethical responsibility should be. We do have a legal regulations as well. We have a legal framework which governs the use of imaging or the radiation in medical imaging to protect the patient and ensure accountability among professionals. So that is regarding the legal regulations. Coming to informed decision making, it is our responsibility to inform the patient adequately regarding the procedure and what are the benefit and risk involved in it. So that is the responsibility of a radiographer or all the healthcare professionals when it comes to patient care. Accountability, professional accountability is healthcare professionals are responsible to adhere to the ethical and legal standard. As we being a healthcare professional, we need to be equally understanding the responsibility ethically as well as in the legal framework. Okay. Now we are going to see what do you understand by the term ethical, legal, what are the unethical practice, what are the illegal practice, and what happens if we know how to govern ourselves, keeping in mind the legal and the ethical practice. Okay, so understanding the ethics and legal principles, ethics refers to what should be done. So, with embracing moral obligations and duties. So, it is basically a morals principle, a moral science. What should be done? There is no any specific rules in this scenario. So there are principles, but there are no proper, written rules of what I mean. There are written rules, which is basically considered as a principle of how we should function ourselves when it comes to ethics. Whereas it comes to legal, it is what must be done. So according to the law established by the regulation, we need to function accordingly. So that is legal. So that is the difference between ethics and legal. Ethics is what should be done, and legal is what must be done. Okay, so this is the basic understanding about legal and ethical principle. Okay, so now what is unethical? Let's have an example of legal but unethical example. So example of legal but unethical behavior is ordering unnecessary imaging for financial gain. That becomes unethical, but it is legal. Why it is legal? Because patient have the right to diagnosis. Okay, so we can have multiple scan order, but that can be easily justified. A doctor can easily justify why that many scan has been prescribed, but it is unethical. So that is one thing we have to understand regarding unethical practice, but it is legal. Now, what is illegal but ethical? A doctor providing free imaging against hospital policy illustrates ethical but illegal behavior. Now, why it is illegal? According to the hospital policy, each scan needs to be paid. But in this case, doctor is going against the hospital policy, which becomes illegal. There is a written guidelines, there is a written policy. So doctor is going against it, that it becomes illegal but ethical. He's doing ethical work. He's not unnecessarily exposing the patient, doing the ethical work, but becomes illegal in terms of hospital guidelines. So this is the understanding of ethical and unethical and illegal example. Okay. Now, what is the importance of ethics and law? Both ethics and law plays crucial role in guiding responsible medical imaging practices and benefit. It impacts on patient right. Now, if you have all this identification, all the understanding of ethics and legal principle, you know now what is the importance of informed consent, how it is important, how what are the responsibility of a healthcare professional. If you know that, you are going to impact on patient right. Now, patient, obviously we have a patient right, patient has the right, so that will be impacted. Other one, understanding the difference helps in protecting patient rights and ensuring quality care. At the end of the day, we are healthcare professionals and we need to be giving excellent quality care, since patients are our customers. So that is one thing we need to understand when it comes to understanding ethical legal principle. Now let's go and understand deep about ethics and legal separately. So first of all, let's talk about the core ethical principle in medical imaging. So first of all, we talk about beneficence. So basically, you ensure that the benefit of imaging procedure significantly outweigh the risk associated with radiation exposure. Now, which radiation protection principle does this beneficence belongs to? It belongs to justification, practice, principle of justification. So what does the principle of justification signify? It signifies that the benefit should outweigh risk. Now, in this case, the core ethical principle just signifies beneficence, which ensures that the benefit of the imaging procedure should significantly outweigh the risk. Okay, so how can we do that? To justify, to avoid unnecessary scan. Okay, we are going to come to the detailed part of it in the coming slides. Now let's talk about non-maleficence. So non-maleficence is a principle, it's ethics principle. So it strives to minimize harm by reducing unnecessary radiation exposure during imaging process. Now, which principle it comes to? From our radiation protection principle, optimization. Yes or no? So how do we optimize? By minimizing the harm. How do we minimize the harm? By reducing the radiation dose. More detail about it we are going to see in the coming slides. Let's talk about autonomy. Now, empower patients by ensuring that they have right to make informed decision regarding their imaging option. Now, how can this autonomy, how can we follow this autonomy principle? By giving informed consent to the patient, by explaining the procedure to the patient, by explaining the alternative imaging modalities to the patient, by explaining the risk and benefit of this imaging procedure to the patient. So for that reason, we need to be knowledgeable enough to understand what are the risks and what are the benefits, as it is the ethical principle of the healthcare professionals to inform the patient regarding the procedure. Next one is justice. So promote fairness by ensuring equal access to safe and effective imaging service to all patients. Now, in this case, it should not be like you should not vary your understanding, your level or your knowledge of radiation protection depending upon the person. Okay, if, for example, you give a proper patient care to the knowledgeable person, whereas you ignore that particular patient care to the uneducated person who have come, or illiterate person who have come, or old person who have come to the radiology department, it should not vary. So that's you have to promote fairness. Both human being, whether irrespective of the socio-economical factor, should get equal fairness in safe radiation use. Okay. Next one is accountability. Radiologist and healthcare professional must adhere to the established ethical standard and maintain trust and safety. So we do have that. We have the guidelines. Now, who gives the guidelines also we are going to see in the upcoming slides. We have the regulations. Who gives the regulations also? That is a legal framework which we are going to see in the upcoming slides. Okay, so these are the core medical principles in medical imaging which you have to understand. Beneficence, non-maleficence. Beneficence is to make sure that you justify the imaging procedure. Okay, reduce the risk, increase the benefit. Non-maleficence, to make sure that you minimize the harm. How do you minimize the harm? By optimizing the radius. Correct. The third one, autonomy. Autonomy is to make sure that you give patient informed decision making option. Okay, how do you do that? By informing the patient regarding multiple options, risks, and benefit. Justice, irrespective of the socio-economical factor, you have to give fairness by ensuring equal access to safe and effective imaging services. And accountability, you have to make sure that the as a radiologist as well as the radio technologist has to be, adhere to the established guidelines. Okay, so these are the 5 core medical imaging ethical principles. Now let's talk about the justification of imaging procedure. As we all know, what is justification? I'm going to tell today about more detail about justification process also, where it cannot be applied, how it is controversial basically. So clinical necessity of the image. So imaging must be performed only when clinically necessary to avoid unnecessary risk. Now, what is clinically necessary is the question I want to ask. Okay, so clinically necessary, how can you justify that? Now, I have told you in the beginning, there is a patient who comes for the X-ray. A normal fall is there in the, normal car accident is there. Patient is, patient is looks normal, but the image has been, CT scan has been prescribed. So in that case, what are we supposed to do? Now the scan is done, and patient brain is normal. Now the question is normal not diagnosis? Is normal is not diagnosis? That is the question which you need to ask. Now, if you do not do the scan, keeping in mind the ethical principle, thinking unnecessary exposure should not be done. So in that case, next day patient develops there is a brain injury is there because you have not done the scan. So in that case, there will be legal problem, because you are following ethical principle, but you didn't do. You try to be ethical human being by seeing the patient condition and not exposing unnecessarily. Ethical principle guidelines you followed, but legally you will be in trouble. So that's why justification is a controversial statement. Okay, so here in this case, there are guidelines. In India, we do not have it, unfortunately, but in Canadian Radiological Society as well as the European Radiological Society, they have already made a guidelines, a checklist on different patient condition, different patient, when you access, you have to do assessment of the patient. So once the assessment is completed, there are different criteria of the assessment, and if all the criteria is met, then you need to go for the scan. If these criteria are not met for each, kind of accident, each kind of emergencies, there are, there are specific guidelines which has been made. When you use that guidelines, the use of X-ray can be eliminated. The use of exposure can be eliminated. But randomly, by just looking at it, we cannot do that, because is normal also is a diagnosis which we have to keep in mind. Okay, so that's why it becomes a little bit, a controversial thing which is not in our hand. When if we are a radiological technologist, it is not in our hand to justify the imaging procedure. We can only do the second part, which I'm going to tell you in the next slide. So risk of unjustified imaging has to be understood. So unjustified imaging increases radiation exposure, as I've already told you in the beginning. Unnecessary exposure to the patient. One simple, precautionary CT scan caused the thyroid cancer. Is that the reason? We don't know. Okay, so it might lead to that particular harm. So it might be one compounding factor. So what we need to keep in mind. So there are ethical concern over overuse. So defensive medicine practice such as overusing imaging to avoid lawsuit are considered unethical. As I've already told you, like you are just thinking that if tomorrow something happens to the patient and I have not diagnosed that, that becomes a problem ethically, legally. So there will be a lawsuit. So in that case, let's do and be in the safe side. So that is one thing we need to be careful about. But we cannot use this until and unless we have a proper written guidelines on each and every emergencies. Okay, so that we have to understand. So let's talk about the examples of unjustified imaging. A patient normally comes to the hospital and doctor is suggesting to go and do a routine whole body CT scan. That becomes unnecessary without any indication. So that becomes unnecessary exposure to the patient. Okay. So now we cannot say that unnecessary also, as I've already told you, if normal also is a diagnosis. So it becomes, it keeps on piling up. We cannot justify. Anything can be justified. Okay, so that is one thing we have to keep in mind. Justification of the practice is a controversial thing. Patient has to the benefit has to outweigh the risk. One thing we have to keep in mind. Okay, and as a radiological technologist, we do not have the right to justify, because we get the scan, we do the scan. Okay, right now, but in future obviously there might be a development where we can give the justification, because sometimes they might not have a proper radiation knowledge, or the what are the problems when it comes to radiation exposure. And as I've already told you, a small amount of radiation as low as 10 millisievert, which is equivalent to one whole body scan, has the potential of giving cancer to the patient. So that needs to be kept in mind. Now, what is our forte? What we can do as a radiological technologist or radiographers, or as a technical aspect, is reduce the radiation dose as low as reasonably achievable. Okay. Now, this concept, very good concept, but it is very important, and it cannot be done. This optimization cannot be done randomly. Let me justify that. Okay. Now let's understand ALARA. ALARA is as low as reasonably achievable to emphasize minimal radiation exposure. Now, what is the ethical responsibility? So professionals have the ethical obligation to ensure patient safety through careful dose management. Now, what do you understand by the careful dose management? As you can see in numerous point over there, lowest dose possible we have to identify and optimize image quality. Now, it should not only be you are just reducing the dose and image quality you are ignoring. It cannot be done like that. So to obtain as low as reasonably achievable for each phase of each scan, or each scan which you are doing it, you need to do a thorough research on it. So you need to understand how much radiation can be reduced to get lowest achievable dose you need to get, and proper image quality, so that the diagnostic effectiveness is not compromised. Okay. So in this case, you need to do a proper research, identify, because sometimes you do a scan and you see for you the image is correct, and since image quality is a subjective analysis, so different people will have a different way of judging the image. So you need to judge the image by multiple people and make sure that this particular factor works. And obviously it depends upon patient habitus also, patient size also, all those things matters. Yes or no? Patient age also matters. So it need to be done in a very thorough research needs to be done. Then only you are able to do the reduction of the radiation dose. But this is what we should be doing it. This is our forte. Okay. And at the same time, Alara principle is not only about radiation dose. If there is alternative imaging technique, we have to implement that as well. So when can we use this? We can inform the patient during the informed consent time as well. Okay. And other than that, if the radiation is reduced, not necessary that your work is over. Wherever there is an opportunity, you need to shield the sensitive organs such as thyroid, gonadal, and eyes. Okay. So in this case, you have to be very careful about. This is where our experience matters. This is where we need to dive in and make sure that we give excellent patient care. Justification is not in our hand. Optimization is in our hand. We need to understand that. So there is where our ethical principle needs to be implemented. What must, no, what should be done? This is what you should do. Reduce the radiation dose. If the patient is thin, use another kind of exposure. If the pediatric patient, we know about it. I'm going to talk about it in the coming slides as well. But this is where we, as a radiological technologist, should be expertise. This is our expertise. Yours and mine expertise is this. Okay, to keep the radiation dose as low as reasonably achievable. So this is optimization. So I've already told you why do we need to ethical issues are there in pediatric population is because they have a radiosensitive organs. Okay, so we need to be careful. They have a developing organs. So developing organs, their organs are radiosensitive. So in that case, we need to be careful about exposing the patient. So we need to make sure that our radiation exposure is reduced, and you need to tailor the radiation dose as per the patient age. So pediatric protocol is separate. We need to understand that, and that is our ethical. We have to be ethical when it comes to exposing the pediatric patient, because if the organs are sensitive, they have a heightened lifetime cancer risk due to radiation exposure, and we need to make sure that protocol are pediatric specific protocol are made, and you follow also. It's not only it is made; it is there in all the hospitals. You need to follow. You need to keep that in mind. Also, there are multiple things when it comes to uh, radiographing or doing a medical imaging procedure and pediatric patients. It's not only about the reduction of the radiation dose, but it starts from the time you interact with the patient. So from the time you interact with the patient, all the things or the success of the radiograph depends upon that only. So it's not only about your interference with the patient, but about the environment of the radiography room also makes a very big difference. So those are the things which needs to be kept in mind. Like for example, if you are talking about ethical practice, means you need to be good at communication, because you need to make sure that you are able to uh, child or the pediatric who has come to the radiography room, you need to convince them for the radiograph. That also is very important. If they are convinced, if they're not crying, if they are cooperative, then your radiograph will be successful. Otherwise, if they are moving around, if they are agitating, in that case there might be a chance that you have to repeat. So if there is a repeat, there is a double exposure. So that is the one thing which you have to keep in mind. Another part, alternating to radiation imaging. So alternative, what are the alternatives? We can use ultrasound, sometimes possible. MRI for the pediatric person might be difficult because it takes longer time, and there might be a motion artifact. In that case, all those things needs to be kept in mind. Okay. So there is an image gently campaign as well. So that is a campaign which gives the awareness regarding the reduction of the radiation dose, all those aspects of the ethical issues in pediatric imaging. And obviously, we need to avoid unnecessary scans. Like I've already told you, this is like, for example, a 5-year-old child falls, for example, and while playing and hits the head. So his worried parents rush into the emergency room. The doctor concerned about the possible brain injury because he need to save himself. Because if you do not do the scan, and if there is a problem inside the brain, there might be a lawsuit. So for that reason, doctors, possible brain injury scan, CT scan was conducted, which is equivalent to 200 chest X-rays again. Okay, so a decade later, the child developed leukemia. Now, will that be a problem? It obviously can be a leading cause, might be a leading cause for the leukemia. So for that reason, we need to avoid unnecessary scans to the patient. So that is our one responsibility as a radiation worker. Okay, that is our ethical practice. We need to be equally concerned about the pregnant patient also. Yes or no? So that is one thing. Why we need to be equally concerned about the pregnant patient is because of the fetus are radiosensitive, the developing organs. Okay, I mean developing beings which is being inside the human inside the womb. So we need to be very careful about exposure. So there are certain types. Now, in this case, like if there is a necessity of doing what you call that, diagnosis. So first thing we need to do alternative. Yes or no? So ultrasound can be done, MRI can be done. Okay, so these are the first thing alternative we need to understand. Now let's understand in the proper steps. So first thing, radiation exposure risk, we need to understand there is an increased risk of cancer, and developmental disorder can happen when it comes to exposure to fetus. So we need to understand the risk. We need to prioritize safe imaging. So MRI and ultrasound can be used, as I've already told you earlier. Okay, to you know to make sure that the effect of radiation will not be there. If necessary, if there is no MRI ultrasound, we can implement late shielding also, but the exposure can be done only during, like we know that there are 3 trimesters. So third trimester is considered as the safest. First and second half, second trimester are not considered safe. Okay, in third trimester, using the late shield, all those things you can still do the exposure of the radiation, but avoiding is what is necessary. If you can do in other modality, well and good. But all this information needs to be informed to the patient. What are the risks involved? Okay, they have a right. So if they are willing not to do and go ahead with the other alternative, it is their responsibility. Okay, then best part is ultrasound is the best, safest. If it can be diagnosed using ultrasound, well and good. If not, then we have to implement late shielding, optimization, all those things. So these are the ethical things which you need to be careful. Patient needs to be informed. They have a 100% right. What are the disadvantages? Okay. Now let's talk about the autonomy of the patient. Now this autonomy is patient right to make informed decision. Okay. So these are the key principle of patient consent in healthcare. So informed decision making, your responsibility, you as a radiological technologist, we have to be giving them informed decision making conditions. Like we need to explain them, educate them regarding the procedure, what happens in the procedure, what are the risks involved, what are the benefits of doing it. Okay, but this scenario does not work in emergency. Okay, what happens in emergency? In life threatening situation, imaging can be proceed without patient consent to save lives. Okay, so that is one thing we have to understand. So patient is in emergency, and you are sometimes, you are in the clinical scenario, and you try to take the consent, does not matter, does not work. Okay, so you have to make sure that to save lives, consent can be avoided for now. For minors and cognitive impaired, like for example, mental unstable patient are those who are in the different level of consciousness. In that case, a legal guardian has to give the consent. So this is another very important. As a healthcare professionals, we have to know whom to they are eligible to get consent, whom they are not. But if you now, if the consent, this ethical practice is to take consent, but if the consent fails, you forget to take consent, and if something wrong happens, legal actions will be taken. There will be a lawsuit. So we have to understand that. Also, there is a patient refusal and imaging is there. Patient has the right to refuse the imaging. We know that, but we need to provide balance. We need to balance this with the medical necessity. So we have to make sure that sometimes patient might refuse it, but we need to make sure that we can convince. We cannot force, but we can convince why it is important. So that's why I was telling you, communication is a key when it comes to patient care. So that also needs to be kept in mind. So you need to communicate with the knowledge obviously we have as a medical imaging you know profession. We have to be able to communicate with people. So this communication works over here in terms of obtaining informed consent. We need to have a communication advantage. Okay. So equity and access to safe imaging, this is one thing we have to keep in mind. So most of these are the things which sometimes might not be in our hand. Like for example, there are certain places where you are working in certain areas where there is no higher modalities available. In that case, we cannot have any option. But when you are working in a tertiary hospital, and you have all the facilities, in that case everyone should have the equity and access to safe imaging. It should not be only, this is my relative, I'm going to give excellent patient care. This is normal patient, I'm not going to give. So it should not differ in that. Okay, so there should not be disparity in imaging access. There should be ethical responsibility in imaging. All the people, I've already told you what are the responsibility, and we have to address overusing and underuse also. Like overusing is to make sure that you don't have a lawsuit, to be in a safe side, you are unnecessarily doing the scan. And underuse also might be a problem sometimes. Your hospital does not have the facility and you want to keep the patient to your hospital and underuse the radiographic imaging diagnostic modality. In that case also there might be a problem. Okay, so that all the things also you have to keep in mind. And obviously rural hospital will have a challenge because every rural hospital will not have a CT scan, so accessing that is not might not be possible, as we, it's not in our hand, what I'm trying to say. But if it is not in our hand, it can be referred outside, and to make sure that the patient gets the quality patient care. So this is regarding the equity and access to imaging, safe imaging. Everyone has the right to have safe imaging. Everyone has the right to get the best possible patient care. So let's talk about some professional ethics and accountability. What are the essential responsibilities of the technicians? So follow ethical codes from medical societies. So there are codes which has been implemented. There are codes which has already been written down. ICMR guidelines are there. Few of the codes how to how to act ourselves as a responsible or ethical professional. And the codes has been written. So that code is like it's not rules that you have to follow. Now it depends upon you as an ethical human being. Are you going to follow or not? So that is entirely based on your moral principles. Okay, so we need to adhere to the radiation safety protocol. So that is one thing. What are the safety protocol, hospital policy, our guidelines policy, what we need to follow. Okay, so undergo continuous education on dose reduction techniques. So obviously we have a dose reduction or the courses, radiation protection courses is available in your curriculum. Other than that, like for example, this webinar, we have multiple talks which was done in the radiation protection scenario. This particular talk also. So like that, you have to have continuous education. Okay, then ethical duty to challenge unnecessary imaging orders. So sometimes right now, once you become a little bit in a higher authority position, in that case you need to be able to, no, not only authority, also when you are working down also, you need to be able to challenge the unnecessary exposure, unnecessary imaging orders. So to know that, you need to have proper knowledge on why it is unnecessary and how can it be avoided. It should not be blindly. Today I have learned about ethical principle, this scan is unnecessary. It should not be done like that. Proper justification needs to be given. Okay, so that is one, professional ethics and accountability as a responsible radiologists as well as the technicians. Okay, now let's talk about the legal framework. We are done with the ethical framework. Okay, ethically, what are we supposed to do, what should be done, we have already understood. Now let's talk about what must be done, because why are we talking about what must be done is because of this many regulatory bodies. So law and regulations is a comprehensive set of law which is established to ensure radiation safety across various sectors. So the top one is ICRP, which is International Commission on Radiological Protection, which ensures ICRP provides recommendation for radiation protection to safeguard public health. US Food and Drug Administrator makes sure that the radiation imaging products are safe. Got it? OSA, that means Occupational Safety and Health Administration, makes sure that the radiation worker like you and me have a safe environment. Okay, it protects us. OSA. Health Insurance Portability and Accountability Act makes sure that there's a privacy of and security of the patient data. In the radiology, everyone image is there with us, so it needs to be protected. Who protects that? HIPAA. Okay, then we have NCRP, which develops recommendation for radiation protection and measurement standards. And in Indian scenario, we have AERB, Atomic Energy Regulatory Board. So until and unless we don't have approval from Atomic Energy Regulatory Board, you cannot procure any equipment. You cannot start any radiation facility. If you do that, there will be a lawsuit. There will be a lawsuit in such case that your even entire institute can be, medical license can be revoked. So all those things will happen. So these are the legal. If you do not follow their guidelines, there is a lawsuit. When it comes to ethical, those are the things it should be done. Okay, so there is a difference. So that ethical is what, as a human, responsible human being, you have to follow. Legal, you have to do. If you do not do, you are an illegal person. You will be fined. Okay, so let's talk about the radiation dose limit. These are the specific guidelines given as a from the different regulatory bodies. Like occupational dose limit is 50 millisievert per year. For the pregnant woman, it should be less than 1 millisievert. Okay, then for employer should be legally required to provide radiation monitoring pads. As you go in any hospital, you will be given a TLD, which is a responsibility of a employer. Okay, if they don't give, it will be a problem. Legal problem will happen. Provision of protective equipment, all the employers are supposed to provide lead aprons, lead gloves, lead thyroid shield, all those things. That is the responsibility of employers. Okay, then training on radiation safety, all the employees needs to get regular training. It's not like, you have already studied, you are done with the education. No, about the radiation protection, it keeps on changing every year, now and then. It's a dynamic domain. So obviously we need to uh, train every annually or biannually. This training needs to be given to make sure that thing goes inside there. Sometimes we tend to forget. So in the, like, if there is a too much of workload, in that case, sometimes it might be out of hand. So in that case, we need to be careful about this particular thing, which is training on radiation safety. Why are we uh, learning about all these things? Is because these are the guidelines and we need to follow. Okay, if you do not follow, it becomes a illegal affairs. So these are the legal consequences of negligence and radiation use. Like, there will be a malpractice lawsuit. So what happens if there is a malpractice lawsuit? There will be, reputation damage to the facility. So if there is a malpractice lawsuit, so in that case, you need to be very careful. Informed consent failure, as I want, informed consent is ethical behavior, but if there is a failure, there will be liabilities, legal liabilities for healthcare providers and institutions. Safety protocol non-compliance, in that case, medical licenses will be revoked if you do not follow these guidelines about safety. And there are some legal world examples, such as in a few years ago, a hospital in California was sued for 10 million. Why? Because a patient who developed radiation burn due to CT scan. So basically, they meant to do a diagnosis for a stroke, but there was excessive radiation level through which there was a long-term damage. That means a radiation burn was there. So the person who trusted the medical system had no idea that they were being overexposed. So this lawsuit wasn't just about money, but it was bigger. So which was bigger? But who is responsible for ensuring patient safety in medical imaging? So how can we prevent such incidents is what we have to be careful about. Okay. Now, how can that happen? How can a simple CT scan expose? Because might be they might not have done a proper calibration of the equipment. Okay. Whose responsibility is that? A team, a quality team needs to do that. Okay. So that's how legal consequences can happen. Okay, so a 10 million because of the radiation burn. So that's how financial loss to the institute will happen. And the person who did, like, for example, one particular person has done that scan, but that person will be blamed. Why? Because let's see, at the end of the day, there might be a scapegoat they need. So in that case, that might also be a problem. Okay, so you have to be careful about the equipment when you're working in certain hospital. You need to be even responsible enough to understand when was the calibration done, when was the quality control, quality assurance. All those information needs to be there in the. I mean, you have to have those information when you're working in certain institutes to make sure that you are safe, and to make sure that your understanding is safe in giving safeguard to the patient as well. So that is one thing which you have to keep in mind. Okay. Now let's talk about data privacy in radiology. As we all know, radiological images have a sensitive nature, and right now in this present scenario, we have packs, which makes it very easy for the image gets to get leaked, okay, or to get misused. Like for example, in the bigger hospital where the big higher authority people comes and do the X-ray. In that case, there might be a chances that the image leaks. So in that case, HIPAA does the uh, what you call that regulation. They have the regulation to make sure that there is no unauthorized sharing of the image. So if there is unauthorized sharing of the image, it will be punishable. So that we need to keep in mind. We as see we have the access. All the image we have the access. Obviously, all the hospital, all the department also has the access, but we have the access for everything as a rich platform or packs. So in that case, we need to be careful about this data privacy. Okay, so if anyone comes and asks about these things for anyone's image without authority, you cannot give any images. Okay, but that small image will go outside, gets to the media, you get to know the name of the person leaked you, gone. Okay, it becomes a punishable crime. There will be a fine, there will be a imprisonment, all those things will happen. Okay, so we have to be very careful about this domain regarding data privacy and radiology. Since now we are coming to the end of the presentation, we need to talk about AI, the talk of the town. AI is everywhere. Now, is there any ethical and legal concern regarding this? Obviously, it's there. Like, for example, what if there is a bias in AI algorithm? So, AI system can exhibit biases. Like, for example, if there is no proper studies, right now we don't have infrastructure to make sure that this particular AI will give the proper diagnosis. But if you are using it, gives a misdiagnosis, there will be a problem. Okay. Another thing, AI versus human judgment, there are still a debate which exists whether AI should replace human. It will never replace human. It can only assist human. So we don't want AI to replace human. That is one thing we have to keep in mind. So we should not use AI to replace any other. It can assist you. Like for example, out of 100 cases, there are 40, 50 normal cases which AI can eliminate, so that the radiologist can only focus on the proper what you call that only the diseased individual, so that the effectiveness of the reporting will be there. AI in technical part, we have now multiple AIs. Like for example, right now in certain equipments, they have something called as a precise positioning, which helps the which we just have to keep the patient on the table, the system automatically positions. So what does that help? Will help us in making sure that there is no extra areas which is getting exposed. Our scan will be faster. So in that case, first AI is helping us to make sure that we are doing proper patient care. So in that case, we can use AI. Okay, but we cannot judge them. I mean, we cannot fully depend on AI. We need to cross check. Okay, since right now our infrastructure is in a developing phase, so we need to be careful about. So liability concerns will be the questions will be arise if there is any incorrect diagnosis. In that case, we need to be careful about using AI when it comes to diagnosis and ensuring AI technology. There is a stringent medical regulation for the safe implementation. So right now we don't have that facilities. We don't have the infrastructure. Maybe in future we might have it, but we have to understand that it will never replace human. It will just assist human. Okay, so these are few case study which we can discuss. So, like for example, a child with mild head trauma, should a CT scan be done? Okay, the question I'm asking is to you. A pregnant woman needs an abdominal CT, balance risk and necessity. How can we balance that? A hospital with limited MRI access, should we use X-ray instead? Or a radiologist asked to perform an unnecessary scan, what will be the ethical response? So these are the few ethical dilemmas which is present, and I want you guys to justify if you want to if you feel, if you can understand, if you can answer this dilemma, it'll be good. So anyone, a child with mild head trauma, should a CT scan be done? What should be your opinion? Anyone? Like if there is no answer, then I can just say, see, for example, mild head trauma is there. Now, if there is no proper guidelines on what is the patient condition, what is the patient consciousness level, and all the neurological tests are there. So if you do not have those guidelines, obviously CT needs to be done. But if you have those guidelines, as I've already mentioned, UK, European Radiological Society, Canadian Radiological Society has made this guideline, and because of this guideline, there is a reduction of 30% unnecessary exposure in their what do you call that, hospitals. So in this case, yes, if we do not have a guideline, we need to do it. Okay. So make sure that the patient gets equal. So just randomly patient is not having any issues does not mean that patient should not get. No, once the CT is done, there also we need to be careful about. Justification, we have justified. Optimization is very important when it comes to pediatric population. So we need to use pediatric protocol. So that's how we can do it. Okay. About pregnant woman, I've already told you. If it is necessary, you can you can only do it in third trimester by protecting the required region of interest, or use the alternative radiation alternative imaging modalities such as MRI and ultrasound. If ultrasound gives the equal result, then if ultrasound gives you the diagnosis, avoid X-ray. The hospital with limited MRI access, should the X-ray be done? What should be doing this? So can can X-ray give you the same information as MRI? No. So should it be done? No. What should we do? Refer it to the hospital which has MRI, because MRI is a soft tissue modality. X-ray is a bone. So in that case, if soft tissue needs to be accessed, X-ray should not be used. So a radiologist is asked to perform an unnecessary scan. What should be the ethical response? We need to ask the radiologist. Okay. So what should be the ethical response? What is unnecessary? What unnecessary? What define unnecessary? Okay. So it's unnecessary, as I've already told you in our time. Justification is a controversial thing. So unnecessary, we cannot define what is unnecessary because we don't have a proper guidelines. So until and unless we have a proper guidelines, we cannot define unnecessary scan. So that will be the ethical response which I can give. Okay. Now let's have a look at the best practices in ethical and legal compliance. So justify imaging procedure. All the imaging procedure which we did needs to be justified and should be based on medical necessity to promote patient safety. We need to follow ALARA principle, making sure that all the scan we do, all the radiation we expose should be as low as reasonably achievable. Informed consent should be obtained. Explain the patient about the procedure. Respect the autonomy. Equity in imaging access, we have to work towards ensuring equitable access to imaging service for all patients regardless of background. And we need to stay updated on regulations. We need to continuously update knowledge on radiation regulations and AI ethics to maintain compliance and best practices. And very important, data privacy and accountability. So I've already told you what are the consequences if there is any data breach. So in that case, we need to maintain privacy and uphold professional accountability in all imaging practices. So that's all from my side. If there is any questions, I can answer. Any questions?
If anybody has any questions, you can post it in the chat box.
So we have not got any questions yet. No questions, right? Oh, for RTA patient, what are the protocol in CT? Okay, so like I've already told you, see RTA patient right now we do not have a guideline. See, when it comes to radiation protection, there need to be a guideline. Now, what level of what level of emergency it is? If there is a minor scratch, like how is the what I've already told you what emergency has to be done. If the patient is seriously damaged, if there is a bleeding, so obviously we need to do a CT scan. But if there is no external bleeding, should a CT scan be done? Now, in that case, if we have a proper guideline, now if you see the patient is behaving properly, there are neurological examinations which can be done. Like, for example, you move the pen if the patient is following the eyelid. If there are other, scores, there are neurological scores which can be done. So if the patient has passed all those scores, and if the justification of the doctor is fine that the patient does not need the scan, that is what we need to understand. Okay, now if the patient comes to our hospital, so what is our role is, like, for example, if there is RTA, there might be brain scan, there might be neck scan, there might be cervical spine, there might be abdomen. So in that case, we have to make sure that we reduce low as reasonably achievable. Now, looking at how can we reduce in that in RTA cases is depending upon the patient size. So depending upon the patient size, we can optimize the radiation dose, because the amount of exposure is going to be huge. Why? Because there is a uh, emergency involved. So we need to do brain, abdomen, everything. So in that case, we can reduce the radiation dose. Uh, Now, that does not randomly we cannot do. So we need to make sure that we use the radiation effectively. If the patient, if there is a protocol, hospital protocol, and if you have already done the previous study, then you can even reduce the exposure. Like, for example, if the patient is what do you call that, low BMI, so you can use 80 kVp. There are cases 80 kVp protocol for the low BMI patient, the scan comes proper. For normal and obese, you can use 100. For normal and high BMI, you can use 100 kVp also. For above, you have to use protocol. I mean, the what you call that? You have to use 120 kVp for obese patients. So this is how you can have a protocol for RTA patients in CT. Any other questions? I hope I have answered your query. Naveen Thomas. So if there are no more questions, then I think so I can end the session. So before I end the session, let me give you a conclusion remark. So as a healthcare professional, we stand at the intersection of technology and responsibility. So medical imaging is one of the greatest tool of modern medicine, as we all know, which saves lives every day. But with great power comes great responsibility. Every scan we order, every dose of radiation we administer, and every decision we make has a lasting impact. But upholding ethical standards, following legal guidelines, and embracing the ALARA principle, we ensure that we are not just diagnosing diseases, we are protecting lives. So let us commit to using medical imaging wisely, advocating for patient safety, and leading with integrity. Because in the end, the true measure of our profession is not just in the image we produce, but in the trust we uphold and the lives we safeguard. So, thank you for your dedication towards ethical and responsible imaging, and thank you for being here.
Thank you so much, sir, for giving us deep details on the core ethical and legal principles involved in imaging procedures. Surely the participants have gained deep understanding of the obligations of us as technologists to maintain standards of care and to adhere to the relevant laws and regulations.
Thank you. Thank you.
Before we conclude, let me brief the participants about the next speaker for tomorrow. We shall have among us Mrs. Disha Fauza, clinical specialist, medical imaging, AI Mazrui Medical Group UAE, who will be talking on artificial intelligence in UST. Once again, our sincere thanks to our distinguished speaker for sharing such valuable insights to us and to all the participants for your enthusiastic engagement throughout the session. We trust you found the session both informative and enriching. We look forward to having you join us again for another session soon. See you all tomorrow at 11 a.m. Until then, take care.